All right then, so good morning, or actually now is good afternoon, everyone. My name is Sanjana Ramesh. I am a high school senior at Arrowhead Christian Academy, and I'm presenting my systematic review on the effect of a low FODMAP diet in adults with inflammatory bowel disease. Here's a quick overview of my presentation for today. So, I'm going to be walking you guys through the motivation for this research, the systemic, systematic methods used, the key findings regarding symptomatic relief versus inflammatory markers, and finally, the conceptual conclusions of the study. So before diving into this research, I want to briefly share a bit of my personal and professional context on this project. So my journey began with a family member's battle against Crohn's disease, a type of IBD, which opened my eyes to the profound and often debilitating impact of GI symptoms on daily life. And this led me to explore the low FODMAP diet, and I really wanted to research and understand the benefits from a scientific perspective. And there's also a lack of clear evidence related to the benefits associated with dietary approaches supporting patients with IBD. So that's why I wanted to go into this. Also, I'm presenting from California, San Bernardino County, and my mentor for this project his name is Brandon Lee, and he's an MD at Boston University. So, a little bit of the background of the research. So, patients with IBD, IBD is inflammatory bowel disease. Some of this includes Crohn's disease and ulcerative colitis, often experience severe functional symptoms such as abdominal pain, cramping, urgency, even when their disease inflammation is under control. And so, this low FODMAP diet, which stands for low fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, has gained a lot of momentum in recent years for its potential benefits in managing the symptoms of IBD. I wanted to look into this a little more, and I wanted to see its role in alleviating gastrointestinal symptoms, specifically in reducing serum and fecal inflammatory biomarkers. Um, and so one of the two biomarkers that I showed was CRP and FC. So CRP is C-reactive protein. So we're looking for elevated levels blood, in blood that serves as a serum biomarker indicating systematic inflammation. And then we're looking at fecal calprotectin, looking to see if it's indicating any GI mucosal inflammation. The aim of this systematic review was to evaluate the effects of the diet on GI symptoms, right, like CRP and FC in adults with IBD. So that was my population. Um, and for my methods, I conducted a systematic review, and a systematic review is conducted searching major databases such as PubMed, Embase, Cochrane Library, and we're only looking at studies that were published up to January of 2025. And this methodology, you can say, was very stringent in the sense that we used Ryan, which is a software for organization, which also allows us to implement the dual reviewer screening process to strengthen the rigor and the credibility of our search. So for inclusion criteria, we're looking at adult IBD patients with the documented use of a strict low FODMAP diet and reporting at least one target outcome like GI symptoms, CRP, or FC. And you can see all of that information there. And then for exclusion criteria, we primarily excluded studies that combined the low FODMAP diet with other approaches, like anti-inflammatory diets, to prevent any confounding variables. So this allows us to precisely attribute any observed effects to FODMAP restriction. So this is a Prisma diagram or chart used to show exactly how many articles we started off with, how much we ended at, and why we took out and removed some articles. So I actually started off with 550 articles, which is a lot. Um, I removed all of the duplicate records, which ended us up with 235 articles that was removed, and so we screened 315 articles. And after removing the duplicates and applying all of our exclusion criteria, we reached a final set of 8 high-quality papers that met our inclusion standards. And so this final cohort was very robust, meaning that include 5 randomized control trials, as you can see here. And so, yeah, so our sample sizes, again, they ranged from adult population or participant ages range from adult population, so 18 to 80, and our sample sizes in the study ranged from 19 to 158. Okay, so for results. So across the majority of the studies, the low FODMAP diet demonstrated a significant reduction in the functional GI symptoms. Some of these symptoms include abdominal pain, urgency, bloating, fatulence, etc. Uh, and so our analysis showed that the intake of fructans was a standout trigger for these symptoms, meaning that this diet works by eliminating fermentable foods. For example, some of the high FODMAP items are like onion, garlic, and wheat, while the low FODMAP foods are like things like lean proteins, specifically unseasoned poultry, rice, oats, and even some fruits and vegetables such as carrots or strawberries. However, when assessing the core inflammational markers, such as CRP and FCC, we saw a bit of a change. We saw that in CRP that there was no significant change in systematic inflammation, indicating that the diet is unlikely to have a significant benefit on the disease's active inflammatory state. Whereas in FC, similarly, most studies showed no significant change in fecal calprotectin, suggesting a lack of consistent anti-inflammatory effects on the gut mucosa. While we did have actually one randomized control trial, which did show a decrease, the overall evidence points toward a negligible impact on inflammation. So, to conclude, what it is that I found. Um, the low FODMAP diet functions primarily as a symptomatic management strategy. So it's highly effective at improving functional symptoms, which is a major component of the patient's quality of life. However, this leads us to the final conceptual takeaway, which is the low FODMAP diet a viable long-term anti-inflammatory diet for IBD? Uh, and so I would say generally that it's important to, uh, sorry. So I would say that it's important for, again, improving our functional symptoms of IBD, but we also need to combat and also take the low FODMAP diet and also continue standard therapies to manage our inflammatory activity. And so these are my references that I took for this presentation and my all of my articles and everything. And so that's it that I have to share with you all. If you have any questions, feel free to ask me and I'm happy to answer.
Thank you for sharing. I have a few questions, if you don't mind. First and
Sure. Mhm.
foremost, how long were participants staying on the low FODMAP diet for it to be effective? Did you see anything like, well, 2 weeks or 2 months in terms of they're actually seeing those reduction of GI symptoms?
So each of the final 8 articles that I looked at, they had a bit of a varying time in which each of the, patients were going through the diet. But overall, it was more of like a long-term thing that they were looking at. So definitely, I would say around maybe 6 months, even up to a year. So
Mm.
it was definitely enough time for us to observe and see how the low FODMAP diet had effects on the symptoms.
And generally, is this treatment seen as like a lifetime kind of alteration of your diet, or Are people able to add any particular foods back in and see if sensitivities arise?
Absolutely. And again, when it comes to the patient care, it really is dependent on what your doctor says and how they feel, what treatment's best for you. But I
Mm,
would say, based on my research, it's definitely possible that this could be a short-term diet. And maybe, as you said, introducing certain foods
mm,
after some time just to see uh, if what works and what doesn't, right? And so I
yeah.
think that's very important. And yes, I would consider this to be more of a short-term diet. Yes.
And how many foods do you have to avoid on the low FODMAP diet?
It is quite a bit.
Right.
As I mentioned, one of the high FODMAP foods are garlic and onion, which is actually like pretty much everywhere in our food. So it can be really difficult actually to find, like what is the low FODMAP foods. And actually my family member who was actually the one who was on this diet, and I noticed that some of the foods, like the lean poultry and all, like I mentioned, like chicken and all of these other things. If you make small changes in your meals and diets,
Mhm.
removing, garlic and onion, but replacing with other, seasonings and everything, you're able to make healthy swaps that allow you to still enjoy the foods that you like, but still have, follow that low FODMAP diet. That's what I would
Mm.
say for that.